Carter, 5 minutes.
Thank you, Mr. Seiling, for being here. Appreciate it very much. You know, I'm from the state of Georgia, and our population is booming, particularly our elderly population. As a lot of retirees are coming to our state, and certainly that's important. Professionally, I'm a pharmacist. In fact, more specifically, I was a consultant pharmacist at nursing homes. I reviewed patients' charts, made recommendations for senior citizens, and I've probably... I suspect, I don't know, but I suspect I've spent as much time in nursing homes as just about any other member of Congress, if not every other member of Congress. And I've seen it firsthand, and I've seen the struggles of nursing homes firsthand. And that's why I'm so concerned about the nursing home minimum staffing standard rule. And you know, when it comes down to it, and I've often said this, we all, whether it be a Republican, a Democrat, or an independent, we all want the same thing. We want accessible, affordable, quality health care. Everyone wants that. And I'm worried about the accessibility of this. I'm worried about what impact that this rule is going to have on accessibility for senior citizens to the nursing home setting. It's been estimated in Georgia that it's going to result in 10,000 senior citizens not being able to be in a nursing home. And I'm very concerned, as I say. Let me ask you a yes or no question. Do you believe that a rule that decreases accessibility and increases healthcare costs is in the patient's best interest?
Thanks for that question.
It's simple, yes or no. Do you believe a rule that decreases accessibility and increases healthcare costs is in the patient's best interest?
I believe that we, as federal regulators, need to make sure there is safe access for everyone residing in a nursing home.
Okay, I can see you're not going to answer that. So let me ask you, what is CMS's response to an independent analysis that several nursing homes in Georgia will be forced to either reduce capacity or close due to the nurse staffing rule?
I think, again, everyone that lives in a nursing home, or if you are a family member with a loved one in a nursing home, has the right to know that that nursing home is able to provide safe care, and the rule really reaffirms that. I also acknowledge, I know a lot of individual nursing home operators. They're good people that want to serve their residents, and there are workforce challenges. And we heard many comments, had many discussions with the industry and others, and that's why the rule really gives a balanced, staggered approach to it.
But if it's going to result, as this independent study has said, if it's going to result that several nursing homes in Georgia close and that they'll be forced, that some will be forced to reduce capacity, where are the seniors going to go? Where are they going to go if they can't go to the nursing home?
So the final rule makes some important adjustments to account for comments we made, really to help preserve access to safe care, including extending the timelines, having exceptions. And I don't believe we should choose or have a binary choice between a nursing home's economics and safe care in those nursing homes.
Aren't nursing homes, unless it's changed since I've been in a nursing home, and listen, I have spent countless hours in nursing homes. And I mean, countless hours in nursing homes, probably 40 or 50 hours a week at one point in my career. And I know about the challenges in nursing homes. I know them firsthand. I've seen them. I've experienced them. But let me ask you, what kind of data, do you know what continuum of care is, where, you know, you have a senior citizen who goes into a hospital and then they are going into a nursing home for rehabilitation and then they hopefully get to go back home? Well, what kind of data did CMS look into to suggest that the nurse staffing rule wouldn't impact the continuum of care for seniors?
Well, I'd say two things. First, the evidence is clear, and as a clinician, you know that staffing is critical for safety and quality, and there are clear clinical standards around what safe care looks like, but there's also a time frame for implementation.
I'm not arguing that. That's a given. But at the same time, nursing homes go through inspections. Nursing homes go through inspections quite often, and they have to meet certain guidelines, and they have to meet certain standards in order to get relicensed. What's wrong with the rule as it is now and what they've been doing?
I think there are real challenges in the status quo around quality of care, and the rules really focus on access to safe, quality care for everyone that needs to, wants to reside
I
in a
understand.
nursing home.
Let me ask you, and with all due respect, and I do mean it respectfully, when's the last time you were in a nursing home? Listen, I've been in nursing homes late at night. I've been there on weekends. I've seen it firsthand. When's the last time you were in a nursing home?
I've spent significant time in nursing homes with staffing, with nurses, with patients, with families. The number one...
Significant time being?
Yes, especially during COVID. On the ground, in facilities.
Well, you
figuring out
must
how
have
to
gotten a
staff.
free pass because during COVID, the nursing homes, the family members weren't able to go in. They had to go to the windows to see the patients.
The number one thing I heard from family members and residents of nursing homes was, how do I make sure my nursing home is able to staff safely? And that is really what the rule focuses on.
Well, I can't help but disagree that this is going to result in nursing homes reducing capacity and closing, and I don't think that's good. We agree that they should have proper staffing, but I would submit to you that that's why we have licensing, and that's why they have reviews, and that's what they have to pass. Thank you again for being here.
Thank you.
And I yield back.
Gentleman yields back.